Thank you. Sorry about that.
Thanks, Ryan, and thanks everyone for bearing with us. Good afternoon and welcome to today's webinar. This is our last session of the Nurture Me Monthly webinar series. Today we have the evolution of risk reduction, expanding services in a rural community, featuring Holly Richards. My name is Hannah Winkelhofer and I'm the ACE and SCI Prevention Coordinator for the Maine CDC. Before we introduce Holly, just a little housekeeping. So today we're using the Zoom's webinar format, which focuses on the presenter. However, you are encouraged to share questions with Holly to answer in the Q&A section, which I will be monitoring throughout the webinar. If you have any technical questions or would like to add to the conversation, please direct your comments into the general chat section. Near the conclusion of the webinar, Ryan Nealon from Adept will share an evaluation link for today's presentation. We really appreciate you taking a moment to provide your valued feedback, which helps ensure that we are providing quality content. And also, Ryan will be sure to email your participation certificates within 10 business days. And now it is my pleasure to introduce our presenter. Holly Richards is a public health program manager with over 25 years of experience in maternal and child health, substance use prevention, and community health. She leads the behavioral health team at the Healthy Community Coalition of Greater Franklin, a Maine health organization, overseeing services from mobile outreach and stigma education to a recovery center, syringe service program, and rapid infectious disease testing. She also manages grants supporting neonatal abstinence syndrome, EMS, and mental health training with a focus on partnerships and advancing health equity in rural communities. So please help me in welcoming Holly.
Thanks, Hannah. Good afternoon, everyone. So we are here to talk about the evolution of risk reduction, so expanding services in a rural community. So during this session, we will explore the growth of substance use risk reduction efforts in a rural community, which is our community of Franklin County, beginning with our mobile outreach and stigma education and how we expanded to include a recovery center, a syringe services program, maternal and child health initiatives, and rapid Hep C and HIV testing. So some learning objectives for this webinar. We will talk about how rural risk reduction programs can progress from outreach and education to comprehensive services, recognize milestones in rural risk reduction, including mobile outreach, recovery centers, syringe service programs, and rapid infectious disease testing. We will discuss, or I will discuss, how to integrate maternal and child health priorities into risk reduction strategies for families affected by substance use disorder, and describe how building strong cross-sector relationships and engaging a multi-sector consortium can drive success through needs assessments, grant writing, advocacy, and community-led solutions. So some unique challenges faced by Franklin County. People on the call may know where Franklin County is, but Franklin County is a large rural county in Western Maine. The county is home to about 30,000 residents spread over 26 towns, townships, and plantations. The largest town where our organization is located is Farmington, Maine. That's also where Maine Health Franklin, formerly known as Franklin Memorial Hospital, and if people are familiar with the University of Maine at Farmington, is located. So some unique challenges we face are isolation, inadequate transportation, childhood trauma, adolescent hopelessness. There's a declining economy in our county, which continues to be one of the most critical issues and major contributors to rural opioid crisis. So we were once a thriving region of farming, dairy, forestry, paper production, and shoemaking, and the county has experienced a sharp decline in these sectors over the past 2 decades. And then due to our rural geographic, there's extremely limited services and treatment available. So starting point. When we first began this work, our community faced a real lack of services, access to medication-assisted treatment, recovery supports, and risk reduction resources were extremely limited. On top of that, transportation challenges made it even harder for people to get the help they needed. In response to this, in 2016, a multi-stakeholder consortium was created. This group brought together a wide range of partners, so medical providers, law enforcement, community members, social service agencies, to build collaboration, expand opportunities for service. The consortium has become a foundation for our progress. The Healthy Community Coalition has played a central role throughout the process as a trusted community convener. Healthy Community Coalition has led the way in building partnerships, conducting community needs assessment, and using evaluations to guide our strategies. This has been critical in tailoring our efforts to meet the needs on the ground. And so because of this work, we've been able to significantly expand risk reduction and substance use disorder services. New initiatives such as our mobile health unit, Narcan distribution, our recovery center, our syringe services program have all increased access to care while also helping to reduce stigma in our community. So the expansion of services over time, this is just a little timeline. So again, our journey began in 2016 when the Franklin County Rural Recovery Network, formerly known as Race to Recovery Consortium, was established through a MEHAF grant. The initial goal was to increase medication-assisted therapy with providers, but the consortium quickly identified even more gaps and needs for people living with substance use disorder. In 2018, the Health Community Coalition was awarded a HRSA RCORP planning grant, which allowed us to take a deeper look at services in Franklin County and create a plan to address those gaps. In 2020, the plan moved into action. HCC received a HRSA RCORP implementation grant to increase prevention, treatment, and recovery resources. That same year, we also became a Tier 2 distributor of Narcan through Maine General's standing order. Momentum continued into 2022 with 2 significant grants, another MEHAF surge grant to expand risk reduction services through our mobile health unit, and to launch a syringe services program. And then we received a SAMHSA grant awarded to Maine Health's Project Dharma with HCC as a partner. This brought over $1.2 million to expand mobile risk reduction services in our rural area. 2023 was a landmark year. We received sustainable state funding to open and support a recovery center in Franklin County, and we established a substance use disorder community health worker. We opened the Franklin County Recovery Center with 2 locations in Jay and Farmington. That same year, we received a HRSA RCORP, RCORP overdose prevention grant to expand MAT and mobile risk reduction services, as well as a HRSA neonatal abstinence syndrome grant to reduce neonatal abstinence syndrome across Western Maine. An award of $1.5 million. Healthy Community Coalition was also recognized with the certification of Maine General's first syringe services exchange approved at 2 sites in Farmington and Strong. By 2024, those efforts came to life with the Franklin County Syringe Service Exchange, offering weekly services alternating between 2 locations in Farmington and Strong. And to strengthen our reach even further, all staff were trained in risk reduction education, overdose awareness, and Narcan distribution. In 2025, we continue to build on this progress. 2 of our staff have been trained in rapid Hep C and HIV testing. We are going through the clear waiver process right now. And so this will be an important layer of prevention and early intervention to our services. And then through the Maine Recovery Council, we've secured funding to assist with our Franklin County Recovery Center, our syringe services program, and we have a planning grant to conduct a needs assessment in Franklin County. So some of the key strategies we've had for success is our multi-stakeholder consortium that I've mentioned a few times. So this really is the foundation. The strong consortium brings together diverse partners, healthcare providers, law enforcement, community leaders, and those with lived experience. This collaboration has been key to identifying needs and creating solutions that are sustainable and community-driven. Mobile risk reduction outreach. This is our old unit. We have new branding on our unit, but this is what our unit looks like if anyone's seen us out and about. So throughout mobile outreach, we're able to bring services directly to rural communities. So as I said, Franklin County, there's 26 towns, plantations. So we travel throughout. Outreach season is roughly April to October. And so the unit and expanded outreach efforts reduce transportation barriers and provide on-the-spot support for prevention, treatment, and recovery. Naloxone access, expanding access to Narcan has been life-saving. By becoming a tier 2 distributor, we've been able to get Narcan in the hands of those who need it most, family, first responders, community members, while normalizing its use as an essential safety tool. Stigma and education. We've been able to prioritize and address stigma through trainings at community events, through businesses, and just community conversations. We're shifting the narrative around substance use disorder, helping people understand it's a health condition, not a morale failing. The creation of our SUD community health worker has become a trusted resource in the community, helping individuals navigate treatment, recovery services, and support systems. This role ensures people don't fall through the cracks. Oops. So this role, the community health worker role, originally began in a PCP office, working with 6 to 7 providers. They transitioned to our coalition in 2023 for the emergent needs of SUD patients and to increase access to medication assistant therapy services. And one of the biggest developments of this role is establishing a strong community partnership and facilitation of shared knowledge, which has been instrumental in enhancing access to resources, creating a collaborative approach to addressing SUD. Our safe pregnancy, neonatal abstinence. Well, I'll get into talk about that some more, and the recovery center. The rest of them have their own slides, so I'm just gonna advance through some of those. This are establishing our multi-stakeholder consortium. So I told you it was formerly known as Race to Recovery. So anyone who's familiar with that knows that it was that for a long time. It is now the Franklin County Rural Recovery Network. So I've talked about the multi sectors who are part of it. So we meet monthly. We discuss current treatment options in Franklin County. We aim to increase MAP providers and explore and implement pathways to treatment and recovery, and provide that opportunity for partners to discuss overlapping issues among sectors. This is really where most Franklin County providers meet and share what issues they're facing and share resources or programs that they're offering. So our mobile risk reduction, we talked about that. This is an opportunity to better coordinate and improve access to our recovery and risk reduction resources. So some things on our unit, people can come and just get their blood pressure, or they could come and get Narcan. We have at-home testing strips for HIV, Hep C, fentanyl, and xylazine testing strips. We have safe syringe storage, safer sex supplies, drug use risk reduction kits, and safer use supplies. We also connect people to resources and then just basic health screenings. And here is kind of where we go. And so we meet community members where they're at. So in Kingfield, you would see us at Mainly Provisions, which is a grocery store. In other towns, you may see us at a town office, in parking lots, local grocery stores, gas stations. In 2024, 450 individuals were reached. Naloxone access. So I've already talked about that, but anyone can come in and get it from us. But any outreach we have, any tabling events, organizations, we teach people how to use Narcan, and then we can distribute it. Once a month, we also go to the jail and we teach inmates how to use it. And then, like I said, individual requests. Lots of stigma and education on opioid overdose, Narcan education, drug-related stigma. And so here are some of the individuals we reached through the jail, healthcare, education, social service agencies, and the community. I did talk about our community health worker. This patient panel numbers, I think, are a little bit different now. But so essentially, we get referrals directly through Epic, which is through the hospital. They'll refer patients to our community health workers, and then our SUD community health worker takes any of the patients that have substance use disorder. And then we have another community health worker who would work with our neonatal abstinence patients. So if anyone is pregnant or postpartum, they would work with those patients. Sometimes they're looking for treatment. Sometimes it's mostly, sometimes it's just treatment. Other times there's other issues. So they are looking for housing or they have food insecurity, transportation. And so they will help them through all that. Or they're looking for PCP, any of those services. So like I talked about in 2023, we received a neonatal abstinence grant. So this was kind of a first dab for Health Community Coalition working in the maternal and child health field. So they had worked a lot on prevention. And so this grant was kind of our first focus, dabbling in maternal and child health. And so the goals of this grant are to increase access to behavioral health services for rural, pregnant, and postpartum individuals and their families, address community risk factors and social determinants of health by collaborating with community-based organizations, enhance the quality and sustainability of behavioral health services for rural, pregnant, postpartum individuals and their families. And those are just some of the project goals. This was the first grant. So as Hannah had mentioned, Health Community Coalition is part of Maine Health, and Maine Health is divided up into regions, and the mountain region is Franklin County, Oxford County, and Carroll County, New Hampshire. So when you think of hospitals, Maine Health Franklin, Maine Health Stevens, and then Memorial Hospital. And so this grant was the first grant written on behalf of a region. And year one started in Franklin County and has continued. We are entering year 3 this year. Last year, we added on Oxford County. So we've been working with Healthy Oxford Hills and Maine Health Stevens, and they have a community health worker. So really kind of replicating what successes we've had in Farmington and Franklin County into Oxford County. And then starting September 1st, we're going to be moving into Carroll County and working with Memorial Hospital and their Better Life program. And so literally replicating what we've done in these other 2 regions, and they'll be hiring a community health worker there as well. So as I gave that chart of all the timeline of how the services have changed, our Franklin County Recovery Center was created to provide a safe, inclusive space for individuals in substance use recovery, along with their friends and family, can access support, resources, and social connections. This center opened in April of 2023 in 2 locations, in Jay and Farmington, and then in October of 2023, consolidated just to the Farmington area. It's operated by a mix of staff, active participants, creating a peer-led environment that fosters trust, mutual support, and shared ownership. This year in July of 2025, due to our Maine Recovery Council funding, we opened and leased our own center. So we moved into a center. We had been leasing a space from St. Joseph Church in Farmington, which was wonderful, but we were outgrowing and needed our own space. So this is a more permanent space to expand our program and better serve the community. At this center, our programs are robust and diverse, made possible through strong partnerships across Franklin County. The space itself is supported through partnerships with the community, reinforcing the center's role as a community hub. Oversight and guidance comes from an advisory committee composed of local members, including law enforcement, the county jail, liaison, peers, peer recovery coaches, and Health Community Coalition staff. This center is completely peer-led. So there's a peer advisory group that meets twice a month to provide ongoing input. So anything that is offered at this center is really peer focused, and they're the ones running what is being offered. The center operates with a clear mission, code of ethics, and established guidelines for programming, special events such as a movie night, game nights, holiday celebrations. They've done tie-dye events, painting, helping build community connections in a welcoming and supportive environment. So here are some pictures. If anyone's familiar with Farmington, there is called the Ingalls Building, which was an old school, and it's called the Ingalls Center. And so you'll see them putting our our name up there. It's an amazing place now. We are getting lots of other social service agencies. Spurwink is there, Goodwill, literacy volunteers, Svcs, Know Your Options has just joined us, and there's a couple counselors in the building. So it's really been quite amazing for the folks visiting our center. Annually, we have about 1,300 visits to our center and provide over 350 Western Maine transportation passes for transportation. And we submit about 20 referrals to community organizations and outside services. I say 20 plus. So here you'll see some of the folks at our center. In the middle, the guy having his hand up is Tyler. He's our SUD community health worker. You'll see some folks just sitting around chatting. They offer meals on Thursdays, so you see some of them in the kitchen. One of the photos, they're doing tie-dye. Very community focused. Next, we are going to talk about our Franklin County Syringe Services program. So this program is rooted in compassion, safety, and community connections, and is the first SSP in Franklin County established with strong community support. The Franklin County Syringe Services program works to reduce the spread of infectious diseases, such as HIV and hepatitis C, by providing clean and safe supplies, reducing stigma around risk reduction, increasing access to vital health services, and we act as a bridge to substance use disorder treatment. There's been strong community involvement to ensure the program is well received and sustainable, fostering trust and collaborative across sectors. For example, the Sheriff's Office provided a letter of support when we applied for this, and community conversations were held to educate the public, answer questions, and highlight the benefits of the program. The program enjoys support from the community members, law enforcement, healthcare providers, and the SUD treatment community. So we this program is offered on Wednesdays at our Healthy Community Coalition in Farmington. And then the second Wednesday of every month, we take our mobile health unit to Strong, which is a town in Franklin County, to offer these services. And coming soon, we will be offering our mobile health unit on the fourth Wednesday in Livermore Falls at the Maine Health Practices down there. We just have to get approval from our application. So participants must be 18, reside in Maine, and register as a member of the exchange. So this talks about some of the supplies given out. So the services we offer: one-to-one needle exchange, so up to 100 per visit. So it's a one-to-one exchange. People bring in used needles. We give them clean needles, personal care items, wound care supplies, safer sex supplies and education, safer use supplies, STI, HIV, Hep C testing and referrals, risk reduction and overdose prevention education, and then referrals to medical, mental health, and SUD treatment. We will also be offering rapid HIV, Hep C testing once we get through our CLIA waiver. And that is testing we can do on individuals and have results within 20 minutes. And if positive, then referring them to appropriate services. So the impacts of key initiatives in a rural county. So the Franklin County Rural Network, formerly known as the RACE Consortium, we just changed our name, so that's why I keep saying that, has strengthened care delivery through improved referral network and increased awareness of available services. Our community outreach engagement has helped reduce stigma, improve access to risk reduction supplies, and increase awareness of SUD resources. Community readiness for risk reduction services has grown as a viable understanding and increasing across the county. And there's a strong belief in the value of risk reduction in our rural county, including reducing disease, preventing fatal overdoses, increasing referrals to care, and building trust with individuals with SUD. And then to understand this impact, the Substance Use Research and Evaluation SURE team at the Catherine Cutler Institute collected and analyzed data on the RCORP 2020 implementation grant. And so this funding and this evaluation has really led to the other initiatives we've created. They use primary and secondary data to assess program implementation, document the milestones, and examining our successes and challenges of the initiative. Building community trust and capacity definitely has been key in our community. By building community trust, we are creating safe, reliable, and accessible programs that meet local needs. Definitely important to engage diverse stakeholders. So engaging healthcare providers, law enforcement, peers, and community leaders to help strengthen partnerships. Using dialogue and feedback to understand communities' priorities and reduce barriers to care. And then tailoring our strategies through assessment and evaluation to ensure programs are responsive, effective, and sustainable. So some of the lessons learned that over the years are, this is a long-term commitment. So start small and build trust. Addressing SUD and increasing access to services is an ongoing effort and requires sustained dedication and adaptability. There's no quick fixes. Progress is made incrementally over time. Definitely continuous relationship building. So strong, trusted relationships in the community with stakeholders and partners is essential. These connections take time to develop and must be nurtured regularly to ensure ongoing collaboration and support. Another lesson learned is community driven. So really having solutions be community driven, preventing and accessing strategies must be tailored to what the needs and readiness of the community. Regular assessments and open dialogue with local stakeholders are key to staying responsive and effective. Patience and perseverance. In a rural setting, the challenges of stigma, resource scarcity, and resistance to change require patience and persistence. It requires a patient and persistence approach. Success often comes from small, steady wins that build long-term impact. And then collaboration is key. And I think I've talked about this a lot, how cross-sector partnership, engaging multi-sector partners, healthcare providers, law enforcement, schools, local social service agencies, and the community in general, amplify the impact of prevention and risk reduction efforts, ensuring a more comprehensive approach to substance use disorder in the community. So some things we're planning for the future, obviously continuing what we are doing, but we're always looking at ways to grow. So operationalize programs, standardizing and refining the services we offer to ensure consistency and quality, continuing to address the social determinants of health. So tackling barriers like housing, transportation, and access to care. We continuously and will continue to leverage funding opportunities. So like using the Franklin County Planning Grant and opioid settlement funding to strengthen our programs. We are expanding our mobile health risk reduction services. We purchased a second unit to reach more individuals in our county with risk reduction and prevention support. And that second unit will actually be a mobile health clinic. So our goal is to be able to offer clinical services just the same way we offer prevention services on our first mobile health unit and be able to bill for those services. So working with the hospital, seeing maybe missed appointments and transportation being a barrier. And so if we knew someone was missing their appointments consistently for transportation and we were going into the town they lived in, we could schedule an appointment with them and they could meet us in the town they're living in. So grow recovery infrastructure. So we are looking to expand the recovery center. Currently, we are open 2 days a week from 11 to 4, and we know that's not enough. So we've applied for some more funding to expand to a third day, hopefully by the end of fall, and expanding the hours into the evening to get folks that might be working during the day, as well as our syringe services to serve more people. So our syringe services program's been open a little over a year. And so we're looking at doing some marketing and just to market it again. We think it's time that we start marketing and working with providers and other community organizations for referrals. And then seeking sustainability, like I said, through additional grants. We are constantly to maintain our long-term impact. I feel like I did a lot of talking really fast because I am a fast talker, but that means there's a lot more time for questions and answers. So I think we can go to those, Hannah, if people have questions and answers or want to start putting them in the chat. Is that how you want to do it?
Yeah, there aren't any right now, but if anyone has questions, please pop them into the Q&A section, and we can have Holly answer those because we have plenty of time.
Mhm.
All right, we have one. Can you expand on what you mean by adolescent hopelessness?
That must have been on my slide. So we have a whole prevention team that works with adolescents, and that is not my wheelhouse, but that is an area that they focus on hopelessness. And I can definitely get back to this participant, like more so. I just know that a lot of surveys they've done is that adolescents self-report hopelessness. So they report mental health, having mental health issues or substance use disorders. And so it's like a term they use is hopelessness. But I can work with you with this person to get more information that our prevention team is working around this area.
Mm-hmm. Yeah, we can send some more info after as well. All right, we have questions are flowing in now. So someone said there have been some really important community conversations and partnerships happening here in Franklin County around local services and supports. Do we know when the next community conversation is scheduled, and what's the best way to stay informed about these kinds of events moving forward?
So we've done, like with our syringe services program, we did some local conversations with town offices for town meetings to talk about those services. With our community health needs assessment, we had a conversation last fall to that helped inform our next community health needs assessment. We right now during our planning grant, we are doing a survey through different partners and community to assess what service, just to see what people know about the services that are in Franklin County and what they think the needs are. I would say the best way to stay informed with these is checking our Facebook, because that is generally the place where we share most of any meetings or community conversations. But people are also welcome to be a part of our Franklin County Rural Recovery Network, because that is also a great place where we share resources.
All right. Can hospitals not in Franklin County send referrals? For example, at Spring Harbor, we tend to get individuals from that area. Would love to know the EPIC referral code.
Yeah, so we have a name of that person. I don't have the code, but yes, if these individuals are living in Franklin County and are in need of a community health worker, absolutely. So can we mark this one, Hannah, as one to follow back up?
Mm-hmm.
Somehow can I get these so I can follow back up?
I believe so, yeah.
Okay.
All right. Are there any volunteer opportunities available for any of these efforts?
Yes, thanks, Judy. Yes, we actually do take volunteers. So we have a volunteer program and people are welcome to be a part of it. We have volunteers that volunteer a few times a week to a few times a year. So some folks only want to volunteer we have a food pantry at the Main Health Franklin. So sometimes people only want to volunteer at the food pantry during delivery days, which is twice a month. We have a volunteer that's been helping at our Franklin County Recovery Center every Thursday. We have volunteers that just help once a year when we do holiday food bags or help at the Farmington Fair, which we just had last week. So the answer, yes, we do have volunteer opportunities.
Great. How to ensure sustainability in light of reduced funding / wavering support for risk reduction services from administrations?
This is a constant battle for us because we are completely grant funded. We are part of Maine Health and we are part of corporate Maine Health, but we do not get funding from Maine Health. So we strictly rely on grants. And I don't know if I have the right answer. I just know that we are constantly battling that. So we had applied for some funding to really expand our recovery center to full time, and we did not get that. And so we just have to continuously look for other funding and figure out ways we can. Maybe we weren't ready for full time, so we're going to expand at a smaller level. But I will say, our leadership team and director, this is something we talk about weekly in our leadership meetings about ensuring sustainability. Like I said, I don't have the right answer, but we definitely are constantly looking for other funding and making sure we're in alignment with new federal guidelines. So Hannah and Ryan and I were talking earlier. Everything we've done for decades has been harm reduction, and that language is not language you use now. So everything's being changed to risk reduction. And so just really making sure our services are meeting the needs of federal and state guidelines.
We have a comment in the chat that is not a question, but someone offered to let them know if WIC can help with anything. So we can maybe send that person's.
Yeah, so we do have a good partnership, like for Franklin County with the Western Maine Community Action. I think we could probably have a better partnership. I know we've gone in, done training for their staff, but I think absolutely, especially on our mobile health unit, we're kind of gearing up for closing of our mobile health unit for the season, but definitely for next year, there's been times where we have a schedule of where we are for the year that we've had other community organizations join us. Know Your Options. We've had psychiatrists come. And so if WIC wanted to be a part of that, or even WIC tabling maybe at our food pantry, I think that would be amazing. And if anyone wants to get in, I have my contact in this slide. I will help gear people to where they need to go and who they should contact for any of that.
Awesome. Is there a contact person or phone number or link for anyone who might want to volunteer?
Yes, Jody, if you want to reach out directly to me at the end of the slide, I have my email and phone. I can connect you.
Awesome. All right.
And I will also put a plug if anyone is in the Farmington or Franklin County area, like come check us out. Just come say hi to us at HCC, or come check out our Franklin County Risk Recovery Center or our food pantry, or any of our, just come check us out. We've had people just come and check out our mobile health unit and see what it looks like inside and what it's all about. But definitely just come say hi. We would love to show you around.
Oh, perfect. I was just going to ask if you had that.
Yep.
Awesome. So if anyone wants to reach out to Holly, feel free.
And I believe, Hannah, you're going to share the slides after too, right?
Yes, yeah. We will share the slides. Oh, that's exciting. WIC is moving close by the Farmington Recovery Center next month.
I know. We just heard of that, and we are so excited because you're literally within walking distance.
That's awesome.
That's super exciting. Little downtown Farmington is becoming this little hub of social service agencies, all within walking distance, and it's so great for our community.
That's great. I'm not seeing any more questions. We can give it a minute or so if anyone has any more, but if not, we can give folks back a couple of minutes of their day.
And if people think of questions, feel free to email me if you think of questions after, or you just were too shy to ask. I will gladly help answer any questions. And there's a couple on here I want to do some follow-up with too, Hannah.
Yeah, I marked those ones down, so we will get back to those folks. But I think it looks like no more questions, so I think we can wrap up. Thank you, Holly. Really appreciate you being here. And Ryan, really quick before we hop off, Ryan, just put the evaluation link in the chat. So if people don't mind filling that out, that would be super helpful. But thanks everyone for joining, and thank you, Holly.
Thank you.
Have a great rest of your afternoon, everyone. Take care. Thank you, Holly.